Hello, Assalamu alaikum. In this video, we will understand about the hypertension mechanism as well as antihypertensive drug target. We will understand about just without the naming. So we will just understand. But what is the hypertension? Hypertension is a worldwide problem due to many factors, which that will lead to high blood pressure due to the decrease of the volume of the blood vessel or hardening of the blood vessel will lead to decrease the volume will lead to increase the blood pressure. So in this way, for short to understand, the risk factor for the hypertension is smoking is number one, and diabetic person as well as obesity and the genetics. Smoking will lead to increase the coronary heart disease also. But remember, the smoking which that will lead to change the heartbeat. So the complication is stroke, heart attack, aneurysm, hemorrhagic shock, and paralysis. The general causes is the smoking, overeating, gender, age factor, and genetic, as well as epigenetic, due to the environmental factors, which basically epigenetic include the smoking and overeating itself. This is the person for normal blood pressure is 120 over 80 millimeter of mercury is the normal blood pressure. The systolic is 120 and 80 is the diastolic. But the more or less will lead to complication like hypotension or hypertension due to the increase of the blood pressure due to the heartbeat increase. But the normally heartbeat when increase, the flexibility of the blood vessel will prevent the hypertension. For example, the kidney failure, glomerular nephritis, and sodium consume when increase when we will intake the salt, the table salt, will lead to increase the salt, but the excretion will be decreased, and in this way, the juxtaglomerular cell of the nephron will produce the renin. Due to the less excretion of the sodium. In this way, the renin basically will go into the liver and convert into the angiotensinogen. This renin will stimulate basically to the liver to produce the angiotensinogen. Angiotensinogen is the inactive form, remember. Sodium and potassium ATPase stimulation and sodium and proton antiport, which that will lead to retention of the sodium while the excretion of the potassium intracellular cation, while the extracellular cation will increase. The renin angiotensin aldosterone system will be activated. In this way, the liver will convert this due to the renin positive feedback will lead to increase the angiotensinogen. Angiotensinogen is the inactive form of the angiotensinogen 1 and 2. The angiotensin 1, which that is convertase enzyme, which that will lead to basically is the endothelin, which that will produce the angiotensinogen 1 and angiotensinogen 1 or angiotensin 1. So not angiotensinogen but angiotensin 1. And the angiotensin 1, due to the angiotensin converting enzyme ACE for short, will trigger the angiotensinogen 1 into the angiotensinogen 2. This angiotensinogen 2 conversion, in this way, the angiotensin converting enzyme ACE, which that produces an angiotensinogen 2. And in this way, the vasoconstriction, the angiotensin 2 receptor blocker and the ACE inhibitor, which that will inhibit, and the angiotensin 2 receptor blocker and the ACE inhibitor, and in this way here you can see the vasoconstriction will occur. but the inhibitor will inhibit it and prevent the vasoconstriction. While this is the angiotensin 2 also stimulate the adrenal cortex to produce aldosterone. We will discuss later. But also the catecholamines, thromboxane, leukotrienes, due to the inflammatory response, the allergic response, endothelin, alpha adrenergic, and hypoxia as well as pH changes, which that will also lead to vascular reactivity and lead to total peripheral resistance will occur. In this, the vasoconstriction will lead to hypertension. So remember the catecholamines and sympathetic nervous system, thromboxane, leukotrienes, endothelin, endothelin and alpha adrenergic neurons, and hypoxia and pH involved for the total peripheral resistance. Remember the calcium channel blocker will inhibit the total peripheral resistance and hypertension. This hypothalamus will release the antidiuretic hormone will target to the nephron. The aquaporin 2 channel creation will lead to absorb water more. In this way, the water will absorb more, will lead to increase the water reabsorption, and in this way that increase the water reabsorption, the plasma extracellular volume will increase. In this way the volume extracellular volume will increase, and in this way the sodium excretion will decrease when the sodium retention will increase. When the sodium retention will increase, will lead to hypertension, and this hypertension, the plasma increase, the volume of the plasma will increase, will lead to a target to the heart, will change the heart physiology like heart rate, contractility, and also genetic factors and environmental factors will lead to cardiac output and heart rate increase, while the stroke volume will be decreased. So the genetics and the heart rate contractility and environmental factors like diet and smoking will lead to cardiac output increase, while the heart rate and the stroke volume will decrease while the heart rate will increase due to the vasoconstriction. And in this way the vasoconstriction will lead to defective smooth muscle via a chronically vasoconstriction will lead to increase the vascular wall thickness, which that hardening of the vascular wall will impede the blood flow, and in this way the resistance will occur. In this way the total peripheral resistance will occur. Systolic blood pressure will be increased more than 120 millimeter of mercury, and diastolic blood pressure will also increase more than 90 millimeter of mercury will lead to hypertension. And in this way the angiotensin 2 in the renin angiotensin aldosterone system, for short RAS, will activate the adrenal cortex to produce aldosterone, will lead to sodium retention more increase, will lead to hypertension again increase. The hypertrophy and defective cardiac muscle is the result of the chronic hypertension, and in this way the heart muscle will be hard, and in this way the hypertrophy will lead to more blood flow, for more blood ejection. So in this way, this is the angiotensin 2 blocker will block the angiotensin 2 for normal function of the blood pressure, while on the other hand the L type voltage gated calcium channel blocker is the calcium channel blocker will lead to slow heart rate and blood vessel dilate, while the renin inhibitor, which that will target to the kidney, will lead to nephron will lead to inhibit the renin, and the liver will not convert this renin because it is not producing. So this is the video was about the hypertension mechanism, and shortly we have discussed about the antihypertensive drug. I hope you make sense. If you like my video, please make sure to subscribe, like and share, and give the comment below for understanding better, and see you in the next video. For this time, bye.